Dental Fuel, the podcast that focuses on what no one else is talking about. Mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in-between. Dental Fuel is brought to you by Doctors Disability Specialists, a team dedicated to helping dentists and physicians with disability insurance, life insurance, and comprehensive business planning. In this episode, Rhonda talks about why she's a dental assistant and a clinical mistake that her and her team made with packing cord that allowed them to grow together as a team. Ronda Holman, how you doing today?
Great. Thank you, Tanya, for having me. I'm so excited for this interview.
Welcome to Dental Fuel. I'm so excited to see you here in person. I know we usually see you on Instagram and on TikTok, but it's so wonderful to be in person here at our Ignite DDS retreat.
Oh, man, it's something else. Just being around all these like-minded individuals who are just as passionate about dentistry as I am, and to feel like I already know you. You know, I think there's this power in social media where I'm like, oh my gosh, I already know you. Like, even if there's one of the dentists in the room. It's her first time at our retreat. And I'm like, man, I feel like I've known her for 10 years.
So true.
It's so amazing.
True. That's the beauty of social media, huh?
Oh, it's amazing. Yeah.
Rhonda, I would love if you would share with our listeners a little bit about yourself.
Okay. Yeah. Well, I'm a Pisces. My favorite color is pink. I love it. And I have a miniature Australian Shepherd as my dog of choice.
What is the dog's name?
It's Harley, like the motorcycle.
Oh, cute.
Yeah, and it's a girl. So, I mean, we went way off base.
Okay.
Yeah, it throws people off left and right. But as far as dental, which I'm pretty sure that's what you meant by that.
Yes.
I am a 24-year dental assistant. I am military trained.
But you're only 30.
I know, isn't that weird? It's like I found that time machine, from Back to the Future.
Blessed.
But it's not in a car now, so it's way more convenient to use. I don't have to go find an abandoned road or anything.
So 24 years in the profession as a dental assistant.
Mm-hmm.
Wow, very cool. And what got you interested into going into the field of dentistry?
Oh, I was a mouth breather growing up, and I had rampant childhood decay. I had dental crowding, a retrognathic mandible, chronic ear infections, throat infections, and I was at the dentist a lot. So by the time I got my adult teeth, that was time to transition into making them fit into my underdeveloped craniofacial respiratory complex. And I spent a lot of time in ortho. I was 3 years in brackets. And when it came time, you go to the military, right? And they're like, what do you want to do when you grow up? And I'm like, I don't know. And they're like, pick something. And they're like, wait. Before you pick something, you have to take this test. It's like the ASVAB, and it tells you if you could qualify for even that career field. Like, we don't want you to get your hopes up. Mm-hmm. Are you smart enough to do the job? And so I actually tested really high. Yay.
Yeah.
And they said, what do you want to be? And I said, I want to be a dental assistant. I'm like, it's what I knew. I was comfortable. I love the ladies that were my dental assistants when I was a child. They made a really great impact on me. It was always a nice experience considering what it was. And I said, I could do that. I would love to do that. I'm really into teeth now because, everybody's been obsessed about mine.
Well, you have beautiful teeth.
Yeah, it worked out.
But Rhonda, thank you for your service. I know you shared a little bit with us about your time in the military, so thank you for that. And of course, thank you for your service in the dental profession as well too, because you have done a great thing, I'm sure, in your community, but also sharing tips with other dental assistants in the world.
Yeah, so here's what happened when I was first introduced to social media. I'm that old where I had a pager in high school. Cell phones didn't come about. Yeah. Oh my God. Only drug dealers had them, right? But I was not a drug dealer, just so we're clear about that. I remember I didn't have a mentor. So as I was going through all of my hard times as a newer dental assistant, I had to just learn by mistake. And I thought, man, wouldn't it be great if I could use this technology and this reach to help other dental assistants learn from me what not to do and learn how to actually like what you do. And the only way to like what you do is to be comfortable doing it. And the only way to be comfortable doing what you're doing is to learn more about it. And there's a detriment. So dental assistants are necessary. Right? I mean, dentists, I know that in school, you guys don't get a dental assistant, and it's kind of something you have to learn to use in your career. But there comes a time where dental assistants, we're thrown into an op, right? And the dentist gets so agitated when we don't have the right thing next. But how are we supposed to have that forethought because we didn't go to dental school. I mean, dental assisting is kind of all over the place. It's still the Wild West, right? You could be certified. I could be a waitress last night and a dental assistant today, or I could be, a 1-year course. I have like all these letters behind my name. So it's kind of like all over the place, and each state has different requirements for us. Yeah. And with that being said, like a lot of times I would disappoint my dentist by not preemptively thinking of what they would need because I didn't know what they were doing. Mm-hmm. Like I fundamentally didn't understand the chemical bonding process. I didn't understand why my dentist would need this next because I didn't know what to do. I just knew how to do it. And so there's this huge mindset shift with dental assistants and facilitating this desire to learn. Like, why are you doing what you're doing? Because I promise you, the minute you know why you're doing it, it's going to get a lot easier.
It'll make sense.
Oh, man.
Yeah, very true in stating, the different kind of trainings and requirements that each state has. And so everyone's background can be so different. And going into an office, very different offices can vary as well too. So y'all do a great job at learning on the job and knowing how to transform yourself based on the setting that you're in and the procedure that's coming up.
You have to. I mean, and we literally are like the most amazing multitaskers. Like every dental assistant I've ever befriended, like they're amazing, like moms and workers and caretakers, and they organize events in their community. Like it's fascinating, like how good they are at multitasking. So I mean, in my mind, after 24 years, I am a great, what is it called? Jack of
all trades, master of none.
There it is. Yeah. I mean, it's amazing. Like, and I told my dentist one day, I said, I get the privilege of learning a little bit about everything because I don't have the burden of having to know a lot about one thing. And so there's these, a lot of people think of dental assisting as a job. I see it as a career. I mean, I hope it's a career.
Absolutely.
Otherwise, I've had a 24-year job. But I think knowing that it is a career and there is room for growth and these teams develop these skills over a lifetime. Like you all want to get to that place where the whole read my mind thing happens, and it does, but you have to learn together. And that's what I think Ignite is known for. So the reason I gravitated towards Ignite was because we build better teams. Oh my gosh. Like that's like the perfect tagline. I'm like, that's what I want because I didn't start really caring about my career and the trajectory of it until my dentist says, we're going to go learn together. We're doing this together. I expect you to be as good as I am at this particular thing. Why wouldn't we learn together? Well, and that's a fundamental thing that a lot of dentists, there's a cost, right? You have to take another team member to go learn about something that they're not actually going to do. Like they're not placing the implant, but I'm a critical role in making that procedure seamless and cost effective and something that you're willing to put in your wheelhouse as a non-stressful procedure you'd like to offer your patients.
I love that. And what a forward-thinking and great dentist and boss person that you had.
Oh my gosh. Okay. Let me just brag. So
please do.
Her name is Dr. Terry Nelson. She is in Northwest Montana. Our office is called Dental Distinctions. She was a dental assistant first. Okay. So I'm like, we connect on that, right?
Yeah.
And then she went back to school to become a dental hygienist.
Okay.
Practiced dental hygiene for a decade. Okay. And then said, I'm not done. I'm not done.
Wow.
I'm going back to dental school, and then becomes a dentist. So this lady, my mentor, a beautiful human being, is inclusive. Like if I can learn it, you can learn it. And there's no such thing as I don't know how to do that. Like, and now that's my mindset is, I just haven't learned that yet. There's no such thing as I don't know how. It's I haven't learned that yet.
That's right. Yeah. It's not in my wheelhouse yet, but we can get it there.
Yeah, but there's so many people that they have these limiting beliefs. They think that because they're in a certain position or because they make a certain amount of money or because they have a certain amount of responsibilities that they're locked into not feeling like there's room for growth. And it's really unfortunate, and I see this a lot in dentistry over the last two decades, where dental assistants, instead of trying to advance their skills and becoming more of a delegation partner, they're getting out. They're like, you know what? I'm not making a ton of money. Like, I don't get to do anything but this. I'm done. I'm like, no. And there's two reasons I see that happening. there's a lot of us that don't have education debt. So we're really not tied. You know,
It's easy to
if
walk
we don't
away
love
from
it,
it. Right.
and we're not great at it, we don't have to commit to it because we didn't sign a contract or, just different rules apply. And then there's a lot of them that don't have the right mentors, don't feel like empowered. They're not delegating. They're not making them feel like a critical part of the team. And so that commitment isn't there either. It's heartbreaking when I see a dental assistant who's amazing leave the career field or even stay in the career field, but leave for hygiene.
That's a good thing. But
I know, but we need dental assistants,
right? Yeah, it's so true.
And there's got to be room for growth.
I mean, and you're very
it breaks my heart. Like, why can't we have really great dental assistants? Why do all my great dental assistants have to go to hygiene school and become great hygienists, which is awesome, but that doesn't do anything for the autonomy of my career field?
I think it also goes back to the point that you made earlier, that many people feel that it's a job and not really a career or a calling for them. So it is an easy way. It's easy for them to walk away, which is sad. Yeah.
It's really sad. And then, it's just this whole perpetual attrition issue, like I hired a great assistant. She went and got married and had a baby and now she doesn't want to work. Or I lost my great assistant to dental hygiene school. Like you never hear anybody say, I lost a bad assistant. Like the bad ones stay.
Right.
So sometimes you just have to learn to work with what you got. And that's about facilitating this education passion and this environment for growth and just saying I want to do better. I want you to do better so we can do better together.
It's all about team growth.
Oh, it's unreal. I've been around, right? So I was a military wife after I left the military. So we moved around every 3 years and I've gotten the chance to work for a lot of different dentists, a lot of different types, practice models, a lot of different materials, a lot of different technologies. And what I noticed was that is a skill that not every dental assistant has. It can either be a blessing or a curse. So dental assistants are known, if I transfer from one office to another and I have baggage with me,
it'll carry for sure.
Oh, we were just talking to Dr. Rice about this yesterday. We're my dentist didn't do it that way. No, you're just slow motion, with the curse. Don't say that. Yeah, your dentist didn't do it that way. But you know what? That doesn't mean it's the wrong way. And that comes back to probably dental assistants that particular situation, they don't know what's happening. They just know what to do. They know the steps, but they don't know why.
Why? Yes.
So if you don't know why, then you would know that there's alternative ways of doing this one thing.
Yes. Rhonda, here at Dental Fuel, we'll have to cut that. Here at Dental Fuel, we are dedicated to talking about people's mistakes and learning from those mistakes and learning how to grow from that. We all know that dental assistants play a huge role in the dental team. So I would love to know about some clinical mistakes, either that you made or that you saw a clinician make, and how you all grew from a team together.
Oh, gosh. So there's this really neat routing slip that we fabricated for our crown prep and deliveries. So we scan and mill same day. And we were coming into the situation where cord was getting left in the sulcus. And you're oh, okay. So it only takes 2 times. I can tell you that in firsthand of a patient coming back saying their gum is inflamed and bleeding and pussy. And you realize, oh, shucks, there's cord in there still. When did we prep that? 2 weeks ago? Ooh. Okay. Well, now we have a checklist. So it's really funny because you took something bad that was, not detrimental, but it's still, one little mistake can lead to 2 big ones. For sure. It's usually a snowball effect. And then we just snipped it in the bud. Okay, we forgot about cord twice. So more than once is an issue. Right. There's a pattern repeating itself. And then, we just came up with this little routing slip. And it's did you remove the cord? Did you take a pre-scan? Did you take a bite? Did you take a trans bite? What shade? And it ended up evolving into this beautiful little piece of paper that makes our whole 3-hour appointment seamless.
I like that. I should put a sheet together. Usually I'll tell my assistant, I go, if you don't hear me say, we're taking the cord out now, you got to tell me.
Right.
And they're usually pretty good. And we count all the things.
There's ways to do it. Yeah. You could put a 2x2 out on the doctor tray. Nice. But it's just nice because I put one blue in, I put one purple or 0001, and then you just cross it off as you take it out.
When you all were talking about, the 2 times that happened, how did you all as a team come forth with the idea of putting the checklist together?
Well, like I said, after the first time, you're like, oh, that was, a fluke. And then the second time, you're like, oh, because, everybody, when you implement new technology, there was a lot of stuff we had to learn as older dentists and dental assistants about this whole scanning and milling thing that threw us for a loop, It's all about systems and protocols and developing them. And we've always done that. Like, that's always been our go-to. Instead of harping on the things we did wrong, we always look at it from that lens of what's the opportunity here? Like, how can I make this better? Because I don't like stress. My dentist doesn't like stress, and my patients don't like stress.
Do you all find a time throughout the day, throughout the week, in the month to come together to look back at things that went wrong, to find solutions to make it better?
We do to some. We're pretty much on the spot. If it's happened in the moment, we'll pull out to the side and be like, okay, what could we have done differently there? So things don't fester. Because a lot of times the dentist, if they don't say something right away, or if I don't say something right away, we let it set for like a week and wait for that monthly meeting. And then it's, at that point, there's some feelings behind it, which shouldn't have been there in the first place. Because we're human. We make mistakes. Like, this is a learning, like they call it practicing dentistry,
That's
right?
We're in the practice of dentistry.
Exactly. And so we'll do like at the best opportunity as close to the incident as possible. We'll do an immediate feedback loop. And then in a morning meeting, be like, hey, what happened yesterday? We just got to double down, make sure we do it this way now, because it's the way we're doing it. And then if for some reason within the next week or two before that meeting that it's been repeated, then clearly we need to write it down. Yeah, like, this is what they expect of me, and this is what I expect of you.
Yeah, that's a good evaluation system to have in place.
Yeah, because sometimes it's a fluke, and you just have to weed it out. Because I've seen dental assistants leave because of the way that constructive criticism was delivered. Again, we don't have student loans. We don't have this connection. There's no financial investment usually with the practice. And some people aren't very good receivers of negative feedback.
Very true.
So it's a very delicate thing, especially if you want to avoid attrition and you want to be a good leader. I honestly, like, every dentist that I've ever worked for that has kept the team together is somebody who has gone through extra programs to develop their business skills. Like Simon Sinek, he's amazing. Like, we use a lot of his stuff during our meetings. It's like, hey, this is why you feel this way. This is what you do. Like, this is a human reaction. Like, it's not a cookie cutter thing. Like, everything has to be dealt with in its own different way. But you can have like the bones, right? Like, we always, what's the word? We reverse engineer all the problems. Because then it takes the emotion out of it, but it makes your system at the same time.
Yeah, and what a great pearl that you put in there for our listeners who are clinicians, or really anyone who's looking to become a better leader. If you want to become a better leader, you really need to make that investment in yourself. And there are a lot of great programs available for you, to help you grow and to help you be a better leader in your practice and with those who are around you. Tune in next time where Rhonda talks about a financial mistake she made as a dental assistant. You can find her on TikTok at @the_airway_champion. You can follow Ignite DDS on Instagram at Ignite DDS. And you can find me on Instagram at tsmaestas.dds. Be sure to check out our sponsor, Doctors Disability Specialists.